candidiasis. So there are two types. One is oral candidiasis, the other is vaginal candidiasis. First of all, discussing oral candidiasis. So oral candidiasis is an oral infection caused by fungi of the genus Candida. More importantly, Candida albicans, right? It is often an opportunistic infection. Now, patient will come with a chief complaint of white patches in the mouth that may be wiped off or scratched off easily in thrush. This is the most important and significant sign of oral candidiasis. Burning sensation in the mouth, and the tongue will feel sore, right? Then on examination, there will be typical appearance of the lesion, that is white plaque patches in the mouth. White plaques are removable, important one. Patient has predisposing factor, that is antibiotics, diabetes, dentures, immunosuppression, right? Now let's come to the differential diagnosis in candidiasis. One is oral leukoplakia, then oral hairy leukoplakia, lichen planus, right? So we need to rule out these from oral candidiasis. Like in candidiasis, there are white plaques which can be wiped off. In leukoplakia, white patches cannot be scraped off and may be pre-malignant, right? Similarly, in hairy leukoplakia, corrugated white lesions on the lateral tongue will be present, which cannot be scraped off. In lichen planus, there will be bilateral lace-like white stria, which is basically called Wickham stria, and cannot be scraped off, right? So we need to rule out these diseases. Now let's come to the management of candidiasis. So first of all, discussing the general measure, which are we will maintain good oral hygiene. We'll advise the patient to brush the teeth twice daily and clean his or her tongue, right? To clean and remove denture at night in case the patient is wearing denture, to treat the underlying causes. Now, so far the medication is concerned, we will write nystatin, it is Nelstate drops, either 50 milligram 4 times, or we can also write clotrimazole lozenges 5 times a day, right? We can also write tab diflucan, which is basically fluconazole 150 milligram is a single dose, right? So basically the nystatin and clotrimazole recommendations are appropriate. However, fluconazole 150 milligram is a single dose, is not the standard regime for oral candidiasis, right? Daily therapy for 7 to 14 days is generally recommended. Then we'll advise follow-up, it is 1 to 2 weeks. Now let's discuss vaginal candidiasis. So it is one of the most common cause of vulvovaginitis and is usually caused by Candida albicans, right? Although many women remain asymptomatic, but some comes with the chief complaint of intense vaginal itching, right? Plus vulval irritation and redness, yeasty smell, or thick white curd-like vaginal discharge, or burning sensation during urination, right? The differential diagnosis in vaginal candidiasis are bacterial vaginosis, trichomoniasis, some other STIs. So we need to rule out these, right? Now let's come to the management of vaginal candidiasis. So basically, clotrimazole is used for vaginal candidiasis. That is 200 milligram vaginal tablet, 3 days OD. So it becomes 600 milligram, while clotrimazole 100 milligram OD for 7 days become 700 milligram, right? Then I can also write fluconazole 150 milligram single dose, which is contraindicated in pregnancy, right? Note that topical imidazoles are safe in pregnancy because when it is used topically, it doesn't show any systemic effect, right?